is putting the patient on steroids.
Right, I'm trying to think.
Yes, which you're on. So the steroids basically calms down the immune system. So it basically, so it doesn't chew up the blood cells. Transfusions we don't do because it can make the thing worse. So we only would do transfusions if, for example, you're symptomatic, all of a sudden you have some shortness of breath.
Which he's had for 3 days.
Right. The saturation is okay though. It's probably the sensation of so we checked his O2 saturation, he's fine. That's why he's not on any oxygen or anything like that. So we would only basically do it in emergent cases. Because the reason if we give you transfusions, you're going to develop more antibodies and those blood cells are going to be chewed up within an hour. So the only reason why we would give you some transfusion is if, we test your saturation and it's plummeted and we give you that red blood cell, even though it chews up and can give you some oxygen carrying capacity. That's what we call it. So it's not going to improve your numbers. The steroids is going to be the main thing that improves the numbers. So, your hemoglobin is low, it's 5. It's going to take some time to come up.
5 on a scale of what to what?
What's it supposed to be?
12.
Okay.
14. I'm guessing in a healthy person like you, it should be 14. Okay. Hi, how are you? So it's going to take some time. So we're going to have to. So when did you start having the tea-colored urine?
Maybe 4 or 5 days ago.
4 or 5 days ago. So the hemolysis has been happening then.
Okay.
But I didn't start passing out till 2 days ago.
Mm-hmm.
Last night, really.
Yeah. So it's probably what happens is that a normal person like you probably has a hemoglobin of 13, 14.
Mm-hmm.
The beginning time when it drops, your body compensates for it, so you don't really feel something until the body can't compensate for it anymore.
So if this is autoimmune, is this acute, do you think, or do you think it's like something that's gonna be ongoing?
Good question. Good question. It really depends what caused it. But the thing is, we may never know what caused it. So what will happen is that what we'll do is you're going to be on these high dose steroids and we'll start tapering them down after a certain period of time. Well, we have to wait for the hemoglobin to come up to normal and then we start tapering.
How long does that normally take, you think?
It depends. Usually takes about 3 to 5 days. But it doesn't mean that you have to be in the hospital for 3 to 5 days. Once we get it to, I would say, 8, 9, 10, you can go and then we check your blood test every week. Okay? So, and then the symptoms are about the same. If you start noticing your urine should be improving, this color should be improving every day. So that's one of the signs and symptoms of hemolysis. Because the reason why it's that color is because when you break up your red blood cells, you release bilirubin. And bilirubin is a yellowish color, and that's what makes that.
Okay.
Also, yellowing of the skin or your eyes or anything like that.
And
that's
1 p. Each of those is 1 p. That's like a lot of p for one time.
Yeah, I mean your body's trying to, because the breakdown products, your body's trying to get rid of them. So that's why everything putting you on fluids and everything like that.
When will the jaundice start to kind of dissipate?
We'll believe in 3 to 5 days. It's going to take a time.
How long do you think I'm going to be in the hospital for?
It depends. It depends how long it takes your blood test to go.
So you would take another test when?
Tomorrow morning.
Tomorrow morning? Do I take steroids again today
or? So you got one this morning at 10 a.m. in the ER.
150.
Yeah. So it's 150 every day.
Right.
So I'll put that in the computer to get that every day. And then when you leave, you're going to be on 150 until we start tapering it down.
And you think so hopefully 3 to 5 days I can walk again?
Yeah, I mean it's going to take, yeah.
Alright, cool.
I mean you're young, so your body's pretty compensated.
And you were asking about the heparin
and what about while he's not walking? How about heparin or the leg?
No heparin. Leg squeezers are okay. I mean, so what happens when you get up and walk? You feel like you're about to pass out?
I pass right out.
He does pass out.
Okay.
He's passed out quite a few times, and last night he peed on the floor.
Sure. Leg squeezers are fine. No heparin, because I don't want him to bleed.
Okay.
Leg squeezers are fine. We'll get some leg squeezers on you. But as you lie here, you can move your feet up and down, type of thing like that. Yeah, that's almost as good as the leg squeezers.
Okay.
Can he try from time to time to stand up to see if he's capable?
Well, I mean, you can try sitting on the edge of the bed first. If he's passed out multiple times, I wouldn't do that.
Yeah,
the worst thing right now is him passing out and cracking his head on the bed, and his hemoglobin's already low. We don't want to do that. So let's take things a little easy. We're not, I mean, all your vital signs are stable. so that's good.
Alright.
So your body's compensated well for it. You just have to wait for your immune system to calm down and for the blood counts to come up.
Will he have to forever be seeing you or a specialist, like
He'll be seeing a hematologist. We'll
Hematologist
see.
regularly?
Yeah, definitely within the next 6 to 12 months, definitely.
Okay.
So,
I have Crohn's, so I'm just wondering if it's like that. Like, you know, you have to go every 3
yeah, it's a
months
bit-
or whatever to
Yeah.
check
So
up.
within the first, that's long term. We'll talk about that when he leaves the hospital. But yeah, you're going to be seeing it. During the first 3 months, you're going to be seeing us pretty regularly, and we'll be checking your blood every week for the next 3 months to
Yeah.
see how things are going. And if this is, and then we'll see, and then we'll spread it out to 3 months, 6 months, or whatnot, and then we'll see. Time will tell if this is a one-time thing.
So really,
Or
when
not.
I saw that pee, I should have come in 3 to 5 days ago.
Well, I mean, it's very. This type yes, it's tea colored, but there could be severely dehydrated, many different
Yeah.
things. But when you're feeling weak and fatigued, and
Yeah.
at your age, you shouldn't feel that,
Yeah.
obviously. So,
And
Yeah.
yellow.
But like I was saying
yellow.
yesterday at work,
Yeah.
2 flights of stairs killed me, which
Yeah,
I'd been
yeah,
going up
yeah.
the previous week. Fine.
Yeah. If you were 58, you probably would have passed out already.
Yeah.
Yeah. So you're 38, basically, your body is compensating really well.
He did pass out 3 times.
Yeah.
Yeah.
So it's a hemoglobin of 5. It's very low. Yeah.
Alright, cool. So test tomorrow and more.
Test tomorrow. We'll see how much the hemoglobin improves. No transfusions unless you need it, which is you don't need it right now.
How about diet? Is there certain things he could eat that could help or promote, or no? Okay, it doesn't matter. Okay.
No. The only thing right now is I wouldn't eat anything I would keep away from a lot of sugars because the prednisone can increase your blood sugars.
Alright.
You don't want to give you diabetes or anything like that. So the key thing is in terms of the titrating the steroids, obviously we want to get them down. We want to get the steroids out of the system, but we can't do it too fast because in the past I've seen where doctors titrate it too fast, it comes back real fast.
Yeah, no, I mean,
Yeah.
same with Crohn's.
Yeah, same
Yeah.
thing. So you gotta take it slow, and if this is a one-time thing from that bug bite thing, then it's gonna be a one-time thing. If it's something else that's triggering it, then we're gonna have to monitor it.
Alright.
So let's see.
How do you figure out if something else is triggering it?
We don't know. A lot of times you don't know if that something else is.
Can it just happen out of nowhere?
Mhm.
Sort of like same with
Idiopathic.
Crohn's?
It's
It's like
yeah.
just all of a sudden, boom.
Mhm.
There's
Your
no
immune
warning.
system.
It's just like
Mhm.
just shuts down.
Mhm. Mhm.
So, is there any long-term immunosuppressants that you would go on if it was a reoccurrence? Like if it was something that was.
Well, I mean, this is all like discovery at this point.
Yeah, I know. I'm just
you know.
curious if like.
Yeah,
it's
it's
like-
For the people who have it chronically.
Yeah, who have it
Yeah.
chronically, it depends. So it really depends on if the recurrence is quick or not. So if somebody has, and we taper it off, and then within 2 weeks it's back again, then there's some other things that we can do. We have to consider later on. I mean, one option for some patients who have recurrent is a splenectomy. I don't think we'll have to do that.
What is that?
Removal of the spleen, because the spleen is the largest lymph node in the body. So basically all your blood products are being consumed by the spleen right now, because the spleen is basically going crazy. So I mean that's something down the line. Again, usually steroids work very well. You taper it off. I mean, I have patients that have one-time thing. Then I have patients who have recurrent things. So it really depends.
Alright.
So let's see. I'm hoping it's a one-time thing, and then we go from there.
And also, just one more question. I only have one more question.
No problem.
When does
Any
he?
questions?
When is it that he should know when to call the doctor or go see a doctor? Because he's not like he's
Right.
super like I'm okay. I'm okay.
Yeah. It's the feeling of fatigue, yellowing of the eyes, the skin, the urine is a key thing. Those are kind of the key symptoms. But again, we're going to be monitoring your blood test very closely every week for the first 3 months. So, I mean, you don't all of a sudden go down to 5 within 24 hours.
Okay.
As he said, he's had the
I
urine
guess
for
that's
4
what
days.
I'm like trying to
Yeah,
get
so
out.
he's
Like
had-
I should be fine till tomorrow morning. Like I'm not gonna up and diet at night. Like alright.
No, I mean you're on the steroids right now. How are you feeling right now? About the same, a little better? Or
I mean when they give me the that stuff to numb pain or whatever. You know, my stomach was hurting a lot.
Yeah,
and
yeah,
I had a
yeah.
headache, and that helps.
Okay, good. Yeah, we scanned your stomach. I don't see anything in there because certain infections can cause this stuff, but he doesn't have any infections.
Okay.
You know, checked your gallbladder. Everything's okay from that standpoint. You don't have appendicitis or anything like that. The only thing that they found is some diverticulosis, which is kind of herniations in your colon, but they're not infected. Okay, so that, you know, we just have to watch. I mean, there's, you know, that's something that you have.
Diverticulosis.
Mm-hmm.
Oh, interesting.
And the other thing that we found that you have a little bit of fatty liver going on.
Alright,
So you got to watch the weight, cholesterol, and whatnot.
alright.
Those are the main things that we found.
Okay.
Question?
So
Any
we'll have more
questions?
tomorrow morning then.
Right. So that's.
That has
that's
nothing to
the
do
way-
with the blood, though.
Yeah.
These are some other things. that
Are
we
you talking
found.
about the fatty liver
Fatty
and the
liver?
bilirubin? Whether
the-
that's related?
Oh,
I
is
don't
that
know.
related?
It's not.
No.
It would be direct bilirubin if he's got a lot of indirect bilirubin.
What do you have to worry about with the fatty?
Fatty liver is a kind of emerging thing that's, you know, you have to watch. Basically, if there's a lot of fat in your blood or whatnot, it can deposit into the liver. And long-term fatty liver, like over 10 to 15 years, a lot of patients don't know it can turn into cirrhosis.
Or foie gras.
Yeah,
Sure.
basically, yeah, so basically that's what it is. It turns into cirrhosis. So I don't know if you've seen the report, but over like the past 10 to 15 years, a lot of people have been dying of liver cancer, and the reason is because of fatty liver, not because of people drinking.
So how do we keep that down?
Gotta watch the weight. Gotta lose some weight.
Yes, I'm right.
You're a little bit overweight,
Yeah.
right? So that's what we gotta do.
I just had my liver and kidneys checked on VA,
Mhm.
and they were amazed at how
I believe that's wrong.
young
Mm-hmm.
I drink,
I lose weight.
and they said your liver and kidney are in incredible
Good,
shape.
good. Yeah, but there's
Is there any
Is
way
this a
to,
hereditary type thing?
no, it's fatty liver. I mean,
Just
fatty
so,
liver
yeah.
deposit.
is there any way to check his thyroid or any of that? Like he works out a lot and he eats pretty well generally.
The thyroid.
Like a hypothyroid
I
or
don't think it's hyperthyroid.
at one,
Hyperthyroid would be
at
weight
one point
loss.
he was told he had like low testosterone,
Mm-hmm.
and so that might be why it was hard for him to lose weight.
Yeah, I mean those things can be done outpatient. I wouldn't do them in here. Because
Yeah,
the thyroid's
let's
gonna.
focus on this.
Yeah,
Yeah.
let's focus on this thing first. Let's not do a whole kind of head to toe
Yeah.
thing while we're here in the hospital. Let's focus on one thing at a time here. But
Alright.
so, you know, we're gonna check. I mean, you're probably gonna be here for